The opinions and statements expressed in the following program do not necessarily reflect those of WWDB, its staff, or management.
Good day, everyone, and welcome again to another edition of Boomer Generation Radio here from WWDB AM 860 here in beautiful Philadelphia, Pennsylvania, and streaming live on WWDBAM.com. We are welcoming you to another edition of Boomer Generation Radio. And just a quick reminder before we get to our first guest, Dr. David Laskin. If you want to contact the show with some ideas, concerns, comments, you can email us at boomergenerationradio@gmail.com. That's boomergenerationradio@gmail.com. This portion of Boomer Generation Radio is brought to you by Kendal, a system of not-for-profit communities and services located in 8 states in the Northeast, Mid-Atlantic, and near Midwest regions of the United States. Kendal advocates for and empowers older adults to reach their full potential and is committed to working with others to together transform the experience of aging. And to learn more about Kendal, that's Kendal, we invite you to visit kendal.org or call toll-free at 888-759-0128. And we are hopefully welcoming Coleen Kayden on our remote line. Coleen, are you there?
I am.
Great.
Good morning, Richard.
Welcome to Boomer Generation Radio. Coleen Kayden, a medication information services part of a division of the Williams Apothecary Incorporated in beautiful Lancaster, PA, one of the great cities and areas of our local Delaware Valley area. Welcome, Coleen.
Thank you.
Dr. Laskin was on our first segment. He's here to hang out for a little while, and we got onto this conversation about medication and over-medication and the challenges that an adult child will face sometimes when dealing with mom and dad and going through all kinds of medications. We'll come back to visit them and open the medicine cabinet, and there's this array of different colored pills and boxes and things like that. It's a little overwhelming. Talk to me about this whole challenge of the pill culture that we deal with in the United States of America.
Well, I think you hit the nail right on the head. We do have a pill culture. We have been raised as a generation of, you turn on the television and you're bombarded with a pill to fix every ill. And what's challenging, certainly for older adults, is that unfortunately many of us do not grow old with a single medical issue. We have multiple problems, and as a result, often end up seeing multiple physicians, multiple specialists. And while everyone, I have absolute confidence that everybody wants to do the right thing, very often we operate in a vacuum. The pulmonologist takes care of the pulmonary problems, the cardiologist takes care of the cardiology problems, et cetera, et cetera. And what often happens is there's not a comprehensive overview of what's going on with someone's medications. And as a result, more times than I care to admit, people end up receiving medications that may in fact be in conflict with each other. The other problem then becomes people are also taking so many medications that you have what we call the pharmaceutical cascade. People end up having adverse reactions, and then instead of perhaps stepping back and saying, well, what could we eliminate from the process, we actually add another medication to treat a side effect, and then it just continues to compound itself. And the other part of it is, people going to the physician can be a very intimidating experience for some people. They're afraid to ask questions. And as a result, this confusion, you're talking confusion, multiple medications, multiple problems, it snowballs. And, I'm a firm believer that the more information a patient has, the more questions that they ask, the better patient they will be if they understand what's going on. And having this conversation is really, really important, not only with their physician, but certainly with a pharmacist, wherever we can help. I think that's critical. But it's a very sad commentary that probably 10 to 15% of ER admissions for older adults are directly due to medication problems. 18 to 20% of long-term care admissions are because of med use. Either a person's not compliant, they're taking it the wrong way, they're taking too much, they're taking too little, taking it at the wrong time, mixing it with other medications. The problem is quite enormous.
Does it matter? And so, does it matter? A lot of the medication we've seen, because I remember working with my mom, it had to be taken at certain times of the day, or it had to be taken with food, or don't take it with food. Doesn't that get kind of confusing?
It does, and but there are reasons that medications have to be taken at certain times of the day, with or without food, because that can affect how well the medication will work. It can sometimes be used to minimize any adverse effects, such as on the GI tract, et cetera. Sometimes we'll recommend using medications at night because they may cause drowsiness, and a bedtime dose makes sense. And you're right, it is confusing, but there are lots of tools out there today to help people take their medications correctly. There are, Medisets. There are opportunities to pre-pack meds. There are devices that actually will, they'll signal the patient it's time to take your medication. So there are tools out there, and we need to be using more of them, because there's no question that the whole compliance and adherence issue around medication use is, unfortunately, we're heading in the wrong direction. We're not doing a good job with that, and we need to do more of that.
Are those devices, are those like the little... I see friends of mine now, like electronic bracelets or something that speak to you, or...
Sometimes they'll come in a form, the technology will actually, signal you to go take your medications. There are some devices out there where the medication is in compartmentalized, and it will rotate, to an opening at the time that you're to take your medication. And there are some very simple, little pill box, separated 4 times a day, 7 days a week.
Oh, I've seen
and in our particular pharmacy service, we do literally, I'm not exaggerating, we do hundreds of those for people to help keep them compliant. Another interesting point about that is that if we have somebody who, say, is living in an apartment, independent living at one of our long-term care facilities, or even independently in the community, and we do a weekly Mediset for them. If we start to see that there are changes, that they're forgetting, leaving pills in the slots, or the pills are coming back in the wrong places, or they're not being used, that's a signal to us that perhaps, we need to let their physician know, hey, there's something going on here. It may be something very simple, or it may be something more dramatic, like some cognitive impairment, something else. But so we not only use it as a tool to help people stay compliant, but it's also an early signal to us that perhaps things are changing for this person and they may need more intensive oversight.
Coleen, this is David Laskin. You just brought up a very, very good point, that there is a team effort that's available for people, and that the pharmacist and the physician complement each other. And our goal is to take care of people and to bring them a quality of life.
Couldn't agree more. Absolutely couldn't agree more. And, I think there was a golden opportunity out there for pharmacists to really fill that void where, that support, not only for the patient, but really to help the physician. I think, Dr. Laskin, you may admit that, physicians sometimes assume that people are taking things the way you told them to. And by using these tools and, being observant of how people are refilling their prescriptions, helping them with Medisets, we can, we often will call the physician and say, something's going on with Mr. Smith. This is the second time his Mediset has come back with his pills in the wrong slots, or half of them are not taken, that type of thing. And by doing that, I think that allows the physician to approach, the patient and family and say, let's have a discussion about what might be happening here.
Well said.
Coleen, in the training of pharmacists, this is something that you guys are alluding to this. How in the training of a pharmacist, how much of an active role is in the training? In other words, is it the job due when you go to the CVS to fill the prescription? Or are pharmacists really being trained to be more aware, alert, be an advocate, be interactive more and more with the patient, with the customer, and with the physician?
There's no question that the training has shifted dramatically from the time I was in pharmacy school many, many moons ago, and to a much more clinical role. And most of the students coming out of pharmacy school today are, much more clinically oriented. Our goal is to be patient advocates. One of the challenges is our business models aren't particularly set up to enhance and take advantage of that.
What do you mean by that?
Unfortunately, we're still, for many pharmacists, we're still sort of in that dispensing role, and the opportunity to speak with patients, to take advantage, take the time to do the things that are necessary, are not always rewarded. I'm trying to be politically correct here, but
go for it. Don't worry about it.
But one of the reasons
is that a code language for profit motive?
Yeah.
Oh, okay.
Yes, pretty much.
Just want to make sure I'm just a plain ordinary guy from Jersey, so I just want to make sure that we understand what you're saying. Yeah,
no, you're absolutely right. One of the reasons I was attracted to the position that I work in now in an independent pharmacy is that I'm very blessed to work for a gentleman who's very forward-thinking. He has always put patients out there first. We do a lot of consulting work, not only in long-term care, but in our community, and I'm also the hospice consultant. And so he's afforded me lots of opportunity to be out there interacting with patients, and he strongly encourages that for all of the pharmacists on staff. I would love to sit here and say that happens in every situation. I don't think we're there yet, but certainly with the whole healthcare reform and ACO models, an ideal situation, if we could figure out how to make it work financially for everyone, would be really to have a pharmacist in a practice setting so that no patient would ever, or family member would ever leave an office without a complete understanding of what medications the doctor prescribed, how they should be used correctly, will they be paid for, and are you using a compliance system that will help make sure that the patient's able to be adherent to the program. It's not a case of playing physician. It's a case of what are the things that we can do to support the plan of care that the physician's putting out there.
It's almost as if on a fantasy level you'd have a future doctor's office where you go see the doctor and then you walk next to the next counter or the next area, and there's the pharmacist who's working in the doctor's office, so that this team approach can be enunciated in a very, very practical way. So wow, that's
our goal. But again, completely, the payment systems right now make it a little difficult for that to happen in all situations. Certainly, some of the ambulatory clinics with some of the larger hospitals or teaching hospitals are doing those very things, and I think they're finding out that this relationship can work quite well. We've actually created a program here in Lancaster where we're going to employers and asking them, do you have employees with critical diabetic needs? And we actually coach them and help them and report back to their physician, give us a plan of care, and this is how we can support it happening. And we've made some great strides. We help patients. We, financially it's good for the company, and physicians have, really welcomed the input. So I think the whole idea, there's so much that goes into the good care of a patient that using a team approach makes good sense to me.
We're speaking with Coleen M. Kayden from the Medication Information Services Division of Williams Apothecary of Lancaster, Pennsylvania. And we'll be back with Coleen. Also, Dr. Laskin is still here just after this reminder that there's a different kind of card game going on in Bucks County coming up. We are exploring how to make end-of-life care decisions in advance with family members through an innovative new game. On Monday evening, June the 16th, at Chandler Hall in Newtown, Pennsylvania. Participants will play this game. Actually, we featured this on Boomer Generation Radio last month. A game called My Gift of Grace, a unique game that stimulates meaningful conversations about living and dying well. Adult children are invited to attend with their parents. Dinner will be served, so join us from 6 to 8 p.m. Monday, June 16th at Chandler Hall, which is located at 99 Barclay Street in Newtown, Bucks County. And you're asked to please RSVP to Chandler Hall at 215-497-0905. It's 215-497-0905. Or online to mygiftofgrace.com/Chandler Hall. That's mygiftofgrace.com/Chandler Hall, as space is limited. Chandler Hall is a nonprofit Kendal community serving older adults in the Quaker tradition. That's this Monday evening, June the 16th. Again, the number 215-497-0905, online at mygiftofgrace.com/Chandler Hall. We're back with Coleen Kayden talking about the whole arena of medication and pharmacy and the interaction thereof. And one of the questions I have to ask you is this confusion about I can get something over the counter, or I can't get it over the counter. I have to knock 3 times at the pharmacist's window, go to the behind the scenes if I want this box. But if I drive 5 hours to Toronto or 8 hours to Toronto, I can get something that I can't get in the United States at a higher dosage, and it's perfectly legal. Coleen, could you walk me through this conundrum?
Well, certainly the whole area of over-the-counter products is a little confusing for people. And the reason that you can go to Toronto and purchase some medications and you can't get them in this country is because the FDA regulates what is permitted to be sold without prescription and what requires a prescription. And more and more products that have traditionally been required a physician's prescription are applying for over-the-counter status. It makes good sense in some respects, but I would argue that it makes good sense only if there is pharmacist involvement in the recommendations. One of the things that I struggle with is the general assumption that because it's sold over the counter, it's not only effective, it's safe and effective. Well, that may be true, but again, that's if you're using that particular product for a particular reason with no other confounding circumstances. But for many older adults who are on medications for anticoagulation, medications for blood pressure, diabetic medications, et cetera, a lot of over-the-counter products can be problematic. And the assumption shouldn't be made that, well, just because I can pick it up and pay for it at the front counter, it's okay for me to use. I strongly stress to the groups that I work with and talk to that you should never buy an over-the-counter product without at least asking the pharmacist, is this okay? I've sent many people out of the pharmacy. Don't tell my boss, but I've sent many people out of the pharmacy and encouraged them to see their physician and not use an over-the-counter product. One, because I suspect they may have a problem that really should have a physician involved, or two, the medication the product that they've picked up over the counter will interfere with the prescribed medication that they're currently on.
So even for something like ibuprofen, you walk in, I had a headache, I over-exercise on the treadmill, my knee hurts, I'm going to pop a couple ibuprofen, and go to the drugstore, and even for something like that?
Well, it's ironic that you would bring up ibuprofen. That could actually be very problematic for some people. As we age, the risk of GI bleeding goes up Thousands of people die every year from silent GI bleeds because of overuse of these medications. And again, for the occasional, if you take the occasional product, but it's America, and if one works, two's better. We tend to,
and three is perfect.
We tend to overuse everything, and people with cardiac conditions, people with renal problems, people with GI issues. Ibuprofen can be quite problematic. I get very frustrated when I see that commercial on TV where the woman comes home and her elderly mother is in the garden and she stands up and she's very stiff and she says, "Here, Mom, grab my Advil." Well, my suspicion as a pharmacist is that older woman shouldn't be using Advil. There are cardiac issues, like I said, renal issues, bleeding issues. So it's not that it's bad medicine; it's that it needs to be used appropriately.
And is it true that everybody metabolizes? Medicaid. Dr. Laskin has talked about this a lot. Metabolizes medication, I guess, not differently because every body is different, and I think that's has to be part of the equation. But one of the other things I just want to throw out a couple of questions to both of you. The level of abuse, drug abuse, legal abuse. What are you seeing? I mean, and as a pharmacist, do you spot this? Do you see this? Are you experiencing this?
Well, we could spend hours talking about this.
We have about 5 minutes.
It's definitely problematic. It's getting worse. I think part of the issue, and I certainly would defer to Dr. Laskin on this, but I think part of the issue is we don't treat pain well. We know a lot about pain management, but there's a lot more that we need to learn. The opioids are very effective, but only for certain types of pain. And I think what happens is we start out with a small problem, and it grows into a big problem because we're not managing pain well. Part of it is understanding, part of it is what are the tools at our disposal. And we now know that, adjuvant therapy is probably very, very effective and important. Non-opioid medications can be quite useful. Physical therapy, all types of things. Sadly, some of the drawback is, our payment systems. We pay for some things, we don't pay for others, and it's not always the best medicine for the type of problem at hand. But do we have a prescription abuse problem? Yes, we definitely do. There's no question. And because we have very powerful controlled substances available via prescription, they have now become attractive to street use as well. So sometimes the abuse comes about because people have their own problem, or they're purchasing these medications to sell, and so it's quite problematic. My concern comes about when legitimate pain patients don't have access because we put rules and restrictions in place that make it difficult for them to receive their proper medication, and it's the old story because of the unfortunate behavior of some of us, all of us are going to pay a huge price.
Well said, Coleen. One of the other things I want to bring up, Richard, is that when we think about pain, we mostly think about physical pain, but there are so many other concepts involved with pain, such as emotional pain,
right?
The social pain, psychological pain, spiritual pain,
and there are pills for that too,
right? Yeah. So it's potentially abusive. So
I want to, because we're starting to literally run out of time, we have about 4 minutes left. We deal, as clergy, as physicians, as pharmacists, we deal with people who are dealing with some really significantly disastrous, horrible medical conditions, cancers, and are always looking for the next, prescription or drug. So the FDA is the vehicle through that legitimatizes or okays drugs in this country. Does it take too long for these types of drugs, really new things to come down the pike in the United States? Because we keep hearing stories that in other countries things are fast-tracked a little bit more. Is our system falling behind? Anybody? I mean,
Dr. Laskin, do you have a thought on that?
At times there are conditions where I think the FDA is slow, but I think the FDA has been a wonderful watchdog, and I think that they have our best interests in place.
Yeah, my thought to that, Richard, is I think it's, they're between a rock and a hard place. Having seen how many recalls have occurred over the years, mm-hmm. I think, we criticize them when they don't fast track, but then when something's out there, and then we have a problem once it comes out into the mass market, then we blame them for not protecting us. So I would agree. There are certainly politics and economics and all different kinds of motivations, but I think the FDA has, over the years, really done a very difficult and demanding, they have a very difficult and demanding responsibility to protect the public, and I think they've done a very good job of that. Like I said, our expectations are sometimes very unrealistic as the public as to what we want to see. I mean, look at a medication like Vioxx, for instance. There were suspicions all along, but it was put out onto the marketplace, not necessarily fast-tracked, but put out there. And then, of course, the reports came out. So the FDA was criticized. Well, how did you let this happen?
So
I think they're between a rock and a hard place.
It sounds again, as we conclude that when it comes to one's own drug prescriptions and protocols, education winds up being again one of the most important, crucial factors to learn about what you're putting into your body, what their interactions are with each other, to talk to your physician and to talk to your pharmacist. And if you have difficulty doing that, get an advocate to help you decode all this stuff. It just seems like it's getting more complicated. And so the more people can rely upon someone else to help them or ask the question, not to be afraid. It's your body. It's your health. Coleen Kayden, thank you very much. Dr. Laskin, thank you for hanging out. And a reminder that this portion of Boomer Generation has been brought to you by Kendal, the system of not-for-profit communities and services that advocates for and empowers older adults to reach their full potential. Together, we're transforming the experience of aging. And again, to learn more about Kendal, that's at kendal.org, Kendal, and the toll-free number 888-759-0128. For all of us here at Boomer Generation Radio and our producer, Tony, thank you very much. We'll see you next Tuesday, 10 a.m. Eastern.